Welcome to this episode of Youth Diary. I'm Deepa, and today we have with us Dr. Vijay Mohan, who is an orthopedic surgeon and he's associated with Aster Medicity, Cochin. Welcome to the show, Doctor.
Thank you.
The first question goes like this, how do we understand that it is a fracture? Many times when we really meet with an accident or when we fall down, we don't really realize that it's an fracture. And what are the symptoms of a fracture and how a fracture can be diagnosed?
Fracture basically means breakage of bones. It's very difficult to miss a fracture unless it's very tiny and displaced fracture. So obviously you'll have pain, then you'll have swelling at the site of fracture, and usually you'll have deformity or movement like crepitus you feel on the fracture. Especially if it's a long bone fracture, many major bones is fractured, you can never miss it because you won't be able to stand on a fractured limb and you won't be able to use a fractured upper limb. So usually it's very difficult to miss a fractured limb, but very small joints like wrist joints or in the foot bones, you can miss a fracture. Then you have to go for an X-ray and find it out.
So what is low back pain and what causes low back pain?
Low back pain is a very common symptom nowadays. Have you ever had back pain?
Yes.
So 90% of the world population will have back pain once or twice in their lifetime. That's estimated. And back pain is the fifth most common symptom, like your fever, your cold, like that. Back pain is the fifth most common that a patient comes to the OPD. If you look at the orthopedic OPD, 50% of the patients come with back pain. And what causes back pain, if you analyze it, there are a lot of causes like inflammations, infections, disc problems, or tumors, cancers, or fractures, or osteoporosis. We can list a lot of things, but all these things together forms only 20% of the causes of back pain. So that means 80% of the people who have back pain doesn't have a reason for that. So we call it, in medical terms, we call it simple back pain or mechanical back pain. So if you look at this, back pain basically arises from the backbone. So there's very small group of muscles that help you to stand erect and move your spine here and there. So there's a delicate balance between these muscles on both sides. So when you lose this balance for some reason, it results in back pain. So that is the most common cause. And what causes, again, major causes of back pain are, the main reason is lack of exercises for the back. And second one is obesity, especially abdominal obesity that causes more stress to the disc on the back, that will give you back pain. Then two other identified causes of back pain is chronic smoking and chronic alcoholism. But if you look at the general population, the major reason for low backache is sedentary activity, no exercises, and obesity.
So what are the symptoms of a torn meniscus, and can you just tell us about the treatment for the same?
If you look at the knee is a totally irregular structure. Both bones that make the knee is totally irregular on either sides. But as you know, that knee movements are very very smooth movements you get in the knee with an irregular bones. The main function of this meniscus is to convert these irregular bones to that smooth movement, and it also helps in equivalent transmission of your body weight down to the legs to the foot. And meniscus gets torn especially in sports activities or in trauma, when you have a twisting injury on the knee or you fall from a height, or a lot of reasons, or very rarely a degenerative tear can also occur in when you are above 40 and something. And main symptom of a torn meniscus will be pain. That you'll have pain while moving the knee or giving weight on the knee, like you're walking or climbing up stairs, or you try to sit down and come up, then you'll have pain. And another common symptom you get is locking. That means, I told you the meniscus is a washer inside the knee. So sometimes some part of this meniscus is torn and it gets entangled into the knee joint. So when you move the knee joint, it gets stuck. So for a second you get severe pain and you cannot move the knee. That's we call locking. The locking is a diagnostic symptom for meniscal symptoms, and knee pain and swelling, and you can get in a lot of other conditions. And the treatment, again, you have to, once you clinically suspect a meniscal injury, X-rays cannot reveal meniscus because you can see bones in the X-ray. So you have to go for an MRI, magnetic resonance scanning. So MRI will give you a clear picture which meniscus is involved, which part of the meniscus is involved. And again, this meniscus being a structure inside the joint, it has two parts. One part has vascularity, that is blood circulation. Other part has no vascularity. So if the meniscus tear is in the vascular area, you can repair it. But if it is in the avascular area with no blood circulation, even if you repair it, won't heal. Then you have to go and remove it and reshape the meniscus into the washer. All these processes nowadays can be done with arthroscopy, that is keyhole surgery. That's why you put small 2 incisions on the knee, you put a camera inside, you have specific sophisticated instruments to go inside, and whether to repair it or remove it, whatever it is. But it's a one-day surgery. You have to be in the hospital only for just one day. Second day you can be back to home. That's the advantage of an arthroscopic surgery. So meniscal injuries are very common injuries nowadays, either due to sports or due to trauma. And it needs to be treated immediately, otherwise it can cause damage to the joint in future.
So this is the next question that we have from audience.
I'm Faisal Mohammed, working at Dowlin. My question is, what are the treatments for arthritis?
Arthritis means actually, word meaning is inflammation of the joints. Like joints are designed for movement. Basically where the 2 bones meet, we call it a joint. So obviously bone being a tough structure, you cannot move it on each other, because it will cause so much of pain. It's like a ball and bearing joint. You have a metal joint and inside you put ball bearings for the smooth movement of that. So we have something called cartilage inside the joint at the end of long bones, which act as the ball bearings in the other joints. And when this cartilage gets damaged due to some reason, we call it arthritis. And the causes of arthritis, again, it can be the major cause is like age-related degeneration. The cartilage starts degeneration after 35 to 40 years of age. Then it slowly, like wear and tear happens. And other causes is like infections. If you get an infection in the joint, the cartilage can get damaged. And there's some inflammatory conditions like that is commonly called as arthritis in layman's language, like rheumatoid arthritis or SLE, like a lot of things. We call Amavadam in Malayalam. And trauma, again fractures. Fractures inside the joint can cause damage to the cartilage. And there are some cancerous conditions that can cause damage, and there is congenital deformities of the joint can also cause more stress to the joint cartilage, and that can erode the cartilage. And all these things lead on to like destruction of the cartilage, and so that smooth movement in the joint is affected. So it ultimately results in pain, again swelling, loss of movement in the joint, and deformity of the joint in that way. So that's we essentially call arthritis. So how do you diagnose arthritis? Means like one is clinical examination, then you have to take an X-ray, and a lot of things can be diagnosed in X-ray alone. And conditions like rheumatoid arthritis, SLE, and it needs blood tests. We have to do some simple blood test, we can diagnose arthritis. And the treatment of arthritis depends on the cause, whether it's wear and tear, or it's an inflammation like a rheumatoid arthritis, or it's a tumor or infection. Depending on that, the treatment varies.
Next question is this.
Hi, I'm Reshma. I'm from Dowling Group. I have a doubt. What are some common knee problems? How they are diagnosis?
It's knee problems. Basically, a lot of people, again, other than low back pain, next common thing patient comes to OPD is with the knee pain. And what are the causes? Again, like we already discussed, like arthritis or infections or inflammations or trauma, all these things, this can arthritis. How you diagnose a knee pain is, first and foremost, is the clinical examination. You have to examine, there's a specific way of examining the knee to find out. Knee being a superficial joint, the most of the structures inside the knee can be palpated with your finger. So majority of the diagnosis of knee problems can be done in an OPD by clinically examining it. And next option is to go for an X-ray. And X-ray will give you a clear picture about the joint stature and structure of bone, and any problems in the bone, all these things will tell you. And certain conditions like ligament injuries or meniscal injuries or some cartilage injuries, those things will not be visible in an X-ray. So then you'll have to go for an MRI. And again, some inflammatory conditions or infectious conditions which you cannot diagnose with X-ray or MRI, then you have to go for some specific blood test. So clinical examination, certain blood test, and X-ray examination, and very rarely MRI can diagnose most of the knee problems that we usually come across.
Next question is this.
Hi sir, I'm Shoaib, working at Dowlin Healthcare. Sir, what is fibromyalgia? What causes or triggers fibromyalgia? And what are the symptoms of fibromyalgia?
To be honest, fibromyalgia is a very, very vague term. So we used to label a lot of patients as fibromyalgic. But if you actually go into the detail of that, there is no clear-cut entity called fibromyalgia. So what happens is, if you are not able to label one patient with a clear-cut diagnosis, people have fibromyalgia. That's what is happening. The causes can be like right from muscle pain or mechanical pain up to psychosomatic disorders. A lot of patients with a lot of stress disorders and psychological disorders, they present with neck pain or back pain or joints pain or generalized body ache and a lot of things. And when you clinically examine, or when you do x-rays, or when you analyze with MRIs or blood tests, everything will be perfect. The bloods will be negative, the x-rays will be normal, but the patient will be feeling pain, and when you palpate, you can feel some painful areas in the body itself. So when we reach that stage, we call it fibromyalgia. The problem with fibromyalgia, it's a chronic condition that just a simple analgesics for 2 days or 5 days will not cure the disease, because it has got a basic mental basis also. So we have to address that also. It's like chronic back pain. So chronic back pain invariably has a mental aspect. So if you just treat the physical aspect with exercises, physiotherapy or drugs, you're not going to cure the patient. Similarly, fibromyalgia also. It's a stress-based disorder. So you need drugs to relax the muscles, and sometimes you will give trigger point injections, certain specific injections given to the trigger points, which triggers the fibromyalgic pain, and some stretching exercises. And moreover that, you need some certain specific drugs which will relieve the mental stress also. Then only you can treat the fibromyalgia.
This is the next question.
My name is Glory Philip. I'm working in Dublin Healthcare. I have one doubt. What cases of neck pain, treatment for neck pain?
Neck pain again a very common condition, especially after this maybe last 10-15 years after the IT boom, and that people are more into computers, and especially personal computers, and so we started seeing a lot of patients with neck pain. Earlier we used to see neck pain only in maybe 50 plus, 60 plus people, but nowadays in 20s or early 30s, a lot of youngsters come with severe neck pain. When we analyze it, it's related to, when we take x-rays, we actually see some degenerative changes in the neck, especially in the discs. And if you go to the basic reason for this, the neck has, the 7 vertebrae are there in the neck, and each vertebrae is mobile in all 4 directions. So the neck is designed for movement. But when you keep the neck stiff without moving in one vertical position, say for half an hour, 1 hour or 2 hours, it's like iron rust. So the neck joints going for wear and tear. So that's the major reason for this neck pain. We call it cervical spondylosis. And another thing is that neck carries the weight of the head. Actually, you have to be in equilibrium position, in the central upright position, for the neck to completely hold the head without any stress. But normally in your office work, or normally when you are in front of computers or in front of personal computers or in a mobile phone, if you look at that, your posture is like you are stooping forward. Your head always comes in front of your body, and your neck is the only structure that supports the head, and it causes tremendous stress on the neck muscles. And our neck joints and neck muscles are not designed for that. So invariably they fail, and we go in for pain. Pain is actually a protective mechanism by the body, because when the muscles are not able to hold the weight of the head without stress, the body is telling you that I cannot hold it. That's why your body gives you pain. So you need not treat the pain, but you have to find out the reason and treat the cause. So again, simple clinical examination and x-rays will help you to diagnose most of the cases. And majority of the cases, I say it's a posture correction and some neck strengthening exercises. And you have to avoid the habit of using the laptops. Actually, laptops, even though they are designed to keep in the lap and work, it's not at all good for your body. It's better you keep the laptop over the desk and keep it like, use a laptop as a desktop. And in the office, always, if it is possible, use a desktop. Otherwise, you are going to have neck pain. And again, there is defined positions for the screen. Your screen should be at eye level. Your keypad should be low. Your elbows should be 110 degrees. If you are not keeping all these things, definitely you are going to get elbow pain, wrist pain, and neck pain. And moreover that, move your neck every 45 minutes or 1 hour. And if you can do these simple things, like your posture correction, your neck movements, you can avoid this neck pain. If you're not doing it, you are invariably going to get, with the present lifestyle, definitely we are going to get neck pain.
With the changing lifestyles and all, becoming more fashionable, I think we're just forgetting about the regular exercise regime and all. So, doctor, can you just throw some light on the, requirement of a healthy lifestyle, including the gymming activities and other exercise and all?
If you look into the OPD distribution, I would say 60 to 70% of the people come with diseases caused by the lifestyle. Whether in orthopedic OPD or cardiology OPD or general medicine OPD, even your diabetes, your hypertension, your cholesterol levels, your heart attack, your neck pain, your back pain, your knee pain, everything, like majority of them are related to your lifestyles. If you look at maybe some 40-50 years back, they were completely healthy till they died. They used to die at 50-55 years of age, but they used to die of maybe heart attack or maybe a cancer or maybe some infection which we didn't have antibiotics to treat. But till the time they died, they were completely healthy.
Oh, they were not getting any disease because of the lifestyle?
Yeah, they were completely healthy.
Healthy, right.
And there was no doubt about use of coconut oil at that time, but we started debating all this is now. So what happened now is like a lot of advancements came in technology. Life became more faster. We had more vehicles to transport us. So we stopped walking, we stopped running. So muscles get exercises when you use them. So we are not using our muscles. So that's why we started getting knee pain, back pain, neck pain, those things. And no exercises, so results in hypertension, hypercholesteremia, again your food habits, all those things. So then the bikes, a lot of people when they come to OPD they ask, can bike cause back pain? A bike cannot. Even one company even actually went ahead and came with special springs in the bike. They claim that they reduce back pain. There's absolutely no relation between a bike and a back pain. The problem is when you have a bike, for just 1 kilometer, you tend to take the bike instead of walking. So whatever essential exercises you get for the back is gone. So that causes back pain. Absolutely, there is no problem in a patient having back pain riding a bike, provided it's a good road. Maybe some of our roads can definitely increase the back pain. So we have to go back to our old culture of doing manual exercises. Either you have to have a habit of walking every day. If you can walk 20 to 30 minutes every day, that will make you completely fit. You don't need to run actually. Jogging is not at all needed. Actually what needed for exercise is brisk walking. And if you are going for a proper exercises in an health club or a gym, then you have to do both weight training and cardio exercises. You have to increase your vital capacity and also increase your muscle strength. So you have to structure that with the advice of an expert. On particular day, there's no point in going and using dumbbells every day. It's only going to harm your body. So you should plan your exercises in such a way that all your muscles and your abdominal muscles, your thigh muscles, your leg muscles, your hand muscles, your neck muscles, everything is trained in a proper way, and plus cardio exercises. So its best thing is to do weight training one day, next day cardio exercises, alternate that day. And of course food habits. We have completely reversed our food habits. There's a proverb that you should eat like a king in the morning, like a prince in the afternoon, like a beggar at night. But what we all do is we completely skip the breakfast. And we eat some sandwiches for the lunch, and we have a very sumptuous dinner and we straight away go to bed. So we have to reverse all these things. If we go back to our old tradition, our old 50 years back, they had meals only 2 times, 10:30 or 11 in the morning and 6-7 in the evening. So that's another thing we can think of. So what we need now is to avoid all these lifestyle related disorders. You have to change your food habits, you have to change your exercise habits. You have to do regular exercises because hypertension, diabetes, cancer, infection, everything. So you are going to live longer, or you have to live healthy till you are 80 or 90 or 100. That's your choice. And what is going to help you is a proper diet and regular exercises.
So we've almost reached the end of the show. That was really nice talking to you, Doctor. Thank you for spending your valuable time here, because it was really useful, and we really got a lot of information, and we can lead a better life, which will be really useful in our daily lives as well. So you guys can stay tuned with us by writing to us on youthdiaryroseball@gmail.com. We'll be coming with all your answers next week. Until then, bye-bye.